Hey class, so today we're going to be talking about Down syndrome, which we've learned about many times this past 3 years. So the etiology of Down syndrome, the most common version is trisomy 21, and basically, as we know, the chromosomes don't separate. And the two least common versions is chromosomal translocation and mosaicism. Alright, for epidemiology, we know that it happens basically 1 in every 800 births. The ratio is about even, male to female. As we know, the older the mother is, the more chance or more risk the mother has of having a baby with Down syndrome. Older than 45 years, 1 case in 50 births. So try to have that baby as soon as possible. And we also know there's no racial bias, so it's pretty even based on the race. Like we said, it increased with the age of the mother, have a better chance of, well, an increased chance of having a child with Down syndrome. And this is new because more young women that are younger of age are having kids. 80% of children with Down syndrome are born to women under the age of 35. So it kind of makes sense. As we know, there's really no real pathology except that a female that already has Down syndrome has a 50% chance of having a child who also has Down syndrome. Alright, life with Down syndrome. So, since technology has increased so much throughout the years, the age has increased dramatically and people are living, they're living longer. The age used to be 25 years, probably around the max, but now it's increased to their lifespan being about 60 years, which is good. People with Down syndrome, they do work, they attend school, and they also, they make important decisions in life. They're not, quote unquote, for lack of a better word, vegetables. They do perform or participate in life. They experience some cognitive delays, but the effect is usually mild to moderate. But they do have many strengths and talents based on each individual case. Lastly, a quality educational program in a stimulating home environment, good health care, and a positive support from family and friends and the community enables people with enables people with Down syndrome, to develop their full potential and lead very fulfilling lives. So the more support you have, the better you are.
There are many clinical signs and symptoms associated with Down syndrome. Many of them, we all know kind of what they're recognized as, how they look. But the truth is they actually vary from person to person. They can be mild to severe. So like I said, widely recognized appearance. Their head is usually smaller than normal. It's abnormally shaped. And abnormally shaped meaning it's round with kind of a flat area on the back. Their inner corner of their eyes are usually rounded instead of pointed. And they usually have a physical development pattern that's slower than most normal children. And they never really reach their average adult height. Some of the physical signs, kind of the hallmark things you're going to see, is at birth they have decreased muscle tone. They'll have excessive skin at the nape of the neck, so kind of in the back here. Flattened nose. Typically the joints in their skull remain separated longer than a normal infant. They have a single crease in the palm of their hand. I have pictures on the next slide to kind of show some of these. Wide, short hands, short fingers, upward slanting eyes, small ears and mouth. They usually have white spots in the colored portion of the eyes called brush field spots, which is kind of a telltale sign. Widely separated first and second toes, and sort of wrinkled and protruded tongue kind of goes with it. So these are some of the things I just talked about. You can see the shape of the nose, the eyes, as well as the head. Here you can kind of see the separation between the toes and the way that the hands are kind of short with this single palmar crease, where the pinky kind of also curves inward. These are some other ones. These are those brush field spots in the eye, and kind of just shows the tongue having the wrinkles, toe separation, kind of a smaller, shorter ear. Some of their developmental or functional impairments, usually they're delayed mentally and socially. They have sort of impulsive behavior, lack of judgment or poor judgment. very short attention span. They're slow to kind of pick up new concepts with learning. As they grow, one of the big things that happens is they become aware that they're different, and it can lead to some frustration and anger, also with some of the physical and mental delays that occur. As far as intellectual ability, you'll see moderate to severe. Some have more challenges as well. Others kind of adapt fine with some interventions. The motivation can be low. The biggest thing too is kind of impaired speech or verbal memory skills and their ability to process things verbally and to communicate them. Some of the musculoskeletal things that pertain to things we would treat them for. General low muscle tone, joint laxity, like we learned about in other classes, upper cervical spine instability. They do tend to have scoliosis if they have had cardiac surgery, which is big in this group. Hip dysplasia is a big one. Patellofemoral instability is another one. It goes along with lots of joint laxity. And then the foot issues that we've talked about, pes planus and metatarsus primus varus is a big thing with these individuals. And motor development issues. So they have a lot of oral, motor, and feeding delays. A lot of that's related to the speech issues, inability to coordinate kind of their muscles that they use for those tasks. Obviously, postural control and balance issues from low tone. They have atypical movement patterns to maintain stability. Delayed gross and fine motor skills. Usually their motor development is below their mental age, so they may be very intelligent, or they may be 3, but they may move like they're a couple years younger. They require more time to learn movements, obviously reduced strength, and usually when they have a visual cue, they do better with a motor task or performing that task rather than having verbal instructions to do it. And because of the low tone, they have much slower reaction times than normal.
All right, well, the prognosis for children with Down syndrome, the life expectancy has increased substantially since the diagnosis first came out. As you see, in 1929, the life expectancy was only about 9 years, and today the life expectancy is 50 years and above, as we said before. And this is just a website that has a lot of information about Down syndrome if you want to check it out.